Hi, I'm Tamara, and this is TELUS Talks with Tamara Taggart. Hi, everyone. Today I am speaking with Dr. Diane McIntosh. Always happy to talk to Dr. McIntosh. She is a psychiatrist and author of the national bestseller, This is Depression. She's also the chief neuroscience officer at TELUS. And this is, I don't know, maybe your third time with us, Diane?
I think so, Tamara. Yes, very happy.
Yeah,
Thank you.
Yeah, so good to see you again. I love our conversations. I always learn so much. And I mean, this topic, we're going to talk about depression today and what depression is and how to talk about depression. And I feel like this is really the perfect time because a lot of people are struggling right now. So maybe we can talk about like what is depression? Like what is the description of what it is?
It sounds like such an easy question. Just tell me, to a psychiatrist, what is depression? But when you look at all the different permutations and combinations, the different symptoms you can have, there's actually about 1,000 different ways that depression can look. So there are some key features. One is a depressed mood, or something called anhedonia, which means a loss in pleasure or interest in things you normally enjoy. But you do not have to have a depressed mood to be depressed. Sometimes when people are depressed, they feel nothing. So you can have a depressed mood, you can have anhedonia, you have to have one or the other of those. Then there's a lot of other symptoms like a change in your sleep. You can sleep too much, you want to sleep all the time, or you're not sleeping at all. A change in your appetite, too much appetite, no appetite at all. And then loss of energy, your brain not working as well as usual, so you're cognitively impaired. Having suicidal thoughts about ending your life. So there's 9 different symptoms. You need 5 of 9, but as you can see, each symptom can be a little bit different for every person.
So, I mean, how would someone know because these are strange times, right? The last year has been extremely stressful. It's been lonely. I mean, we have uncertainty at every angle for the majority of people. Some people I understand, just kind of carried on, but the majority of us, our lives have been, um, you know, they're not the same. So how do we know what is just COVID fatigue ish and what is actual depression? How do we know the difference?
Sometimes it's difficult to tell, and even for me to know what is normal, especially because I might not know that person very well at all. But generally, you have to have some of those symptoms, at least 5 of 9 of the symptoms that I mentioned. But one of the most important things is the impact on your functioning, that you're not functioning in your usual roles as you might normally. And that doesn't just mean at work, but failure to be functioning normally at work means your brain is there, or you're there, but your brain is not. So you're not working to the capacity that you normally would if you were feeling well. But it's also how you're functioning at home. Are you able to parent as effectively as normal? Are you able to maintain relationships in a normal way? So it's not just at work how you're functioning, but are you functioning at a different level than normal? That's powerful in understanding how severe your depression is. And in fact, functional impairment is necessary to have a depression diagnosis.
Right. So not everybody has access, right, to a psychiatrist or a counselor. And I mean, I have friends that have gone online to see what the symptoms are and how many symptoms do they have. If you find that you're in a situation where maybe you have 5 of them or 4 of them of those, uh, what do you recommend people do?
I think the most important thing is don't diagnose yourself. But if you have a worry, something's not right. I'm worried all the time. My mood, it doesn't seem right. I'm short tempered. I'm snapping at people. People are asking me if I'm okay. So if any of that's going on, talk to a healthcare professional. The best place to start, if you have a family doctor, you can go through virtual care or having access to a clinician, whether a nurse practitioner or a family doctor, and they can help you do a clinical scale, ask you the right questions, and then help you to figure out what's the next step. Not everyone who's depressed requires medication. And in fact, there are a lot of things that you can do for yourself that are non-medical that can support your wellness through this really challenging time. But you can't yoga your way out of severe depression. So if you have a moderately severe or severe depression, often you do require some professional help to find your way through there. But even as you start to get well with those sorts of things, whether it's talk therapy or medication, there are those same things that can help to prevent depression and anxiety can also help you in your recovery.
Yeah, that's good advice because we hear a lot about self-care and we just need to take care of ourselves but if you are severely depressed, um, those things I guess may make you feel better in the very, very short term, but it's not a cure.
If you're severely depressed, very often you do require medication if it's a really severe depression. And talk therapy, I'm a big fan. I believe in the power of talk therapy, but the most common one that we heard about is cognitive behavioral therapy, and that requires you to learn new things, to learn new ideas, and to put into place new skills. In order for you to do that, your brain has to work. And if you're really depressed, often you're quite cognitively impaired. So being able to remember and utilize new skills, that's hard work. Talk therapy is hard. And so when you're really depressed, sometimes your brain is just not where it needs to be able to do those skills. That said, things like exercise grows new brain cells. And the good news is it's not a whole lot of exercise. 30 minutes a day of getting your heart rate up is enough to grow brain cells, which is exactly what antidepressants do. They grow new brain cells too. So by doing a little bit of activity, when you're really depressed, any activity can be tough. Even 5 minutes, working up to that 30 minutes, that is a treatment for depression, can support your wellness. Same with eating a healthy diet. We know that your gut biome, the bugs that live in your belly, are good bugs. They need to be there. And if they're off, if your diet is off, it can actually have an impact on your mood. So, eating healthily, exercise, yoga, mindfulness, even faith. If you're a faithful person, there's evidence showing that that can be really helpful for some individuals.
I mean, you're a psychiatrist. This is what you do, and so to hear you talk about all these things like yoga and exercise and eating well might be a surprise to some people because I feel like sometimes people think, oh, all psychiatrists just want to give you medicine for your illness, your mental illness.
So I want my patients who need treatment to love their drugs. And so my job is to make sure that I get the right treatment for the right patient. And I don't always hit it out of the park the first time. It takes time because every brain is an individual brain. So my area of expertise is finding the right treatment for each individual. But if you don't need treatment, medication treatment, I don't want you to have it. And therefore, I want to make sure I send you to the right psychologist, clinical counselor, social worker. Again, that relationship is important and powerful, and sometimes it's not the right connection. So I always ask people, give it a time or two. But if the fit isn't there, any psychologist or counselor should know that it's okay for you to go find someone else. You need to have that fit. And as far as the exercise, the gut biome, the faith and yoga, mindfulness, there's data. Everything that I say in any conversation like this is rooted in where's the science? What that underpins everything that I suggest. There is good science to show us movement, gut biome, all of those really valuable for helping to prevent depression or to treat you or maintain your wellness as you get better.
So, how do we talk about depression? Because, when we come to terms with a diagnosis, if we've been told that we do have depression, I mean, it's not an easy journey, and it's not something that, people are worried you're going to be judged, or work might look at you differently, or your friends might treat you different, or you might not want to tell anybody. So, what's some advice you can give us when we find out, yes, we have this diagnosis. Now what? Now what do I do with this?
So, to me, having this diagnosis, knowing what's going on, in my experience as a psychiatrist for more than 20 years, is generally a relief to people. Thank goodness now I know, and there is a path ahead. But getting there, asking for help, and then dealing sometimes with asking for help and being rebuffed or feeling further embarrassment because of the way that someone responded. I just like everyone to know that there is always a path ahead. And if you don't feel supported by the person that you've spoken to, please don't stop. There is someone out there who's the right person. But I also want to really be very frank and honest in saying the stigma is alive out there. And it's not just sort of in certain groups that are highly stigmatizing. The reality is that the stigma regarding mental illness lives in medicine. It lives amongst my colleagues. This is why people who, I saw someone yesterday, a patient for the first time who was telling me, I hate all psychiatrists. And it was related to their past experience in psychiatry. And I had to say to her, I totally get that. Like every profession, we've got some great people and we've got some not so great people. We have to change the way that people who are living with mental illness are treated within our facilities, within our healthcare system, within medicine. That's the only way we're going to earn trust, and we're going to really break down those stigmatizing layers that prevent people from coming forward.
Yeah, the stigma is definitely still there, even with your friends or, so what about, your employer when it comes to, do you, do you have to tell your employer that you have this diagnosis? Should you tell your employer? Should you tell HR in case you're having troubles or?
It's really very individual. So within TELUS, we have a great deal of support within the organization because from the top down, with our CEO believing in the importance of mental health, all the way through our whole HR, our PNC world, they get that mental health is important and have invested a huge amount of resource and support to make sure that people within the organization are able to access help. But that's not the case within every organization. Your healthcare, whatever it is, your physical or your mental health care, is your personal business. And so you should not disclose it unless it's in a situation of trust and where it can be truly helpful for you in order to be able to perhaps get some supports in place within the organization. Or if you're struggling, there's something called presenteeism, which is not the same as absenteeism. Absenteeism is you're not there. Presenteeism is you're there, but your brain isn't, that you're not functioning to the full level. And sometimes people lose their job because they're ill. They don't want to talk about what's going on. And in fact, they need some support to be able to be effective. Maybe their hours need to be changed or something. And your PNC HR professional can help you with that. But I don't want to make a blanket statement because not everyone is fortunate enough to work in an organization where they have that support. Starting with your family doctor, always helpful to help to get a sort of idea of what kind of support you need, and also to be a sounding board to maybe ask what are their suggestions given your unique circumstances.
Mm. It's interesting because I think pre-COVID, we were, we always had, like, even if you were sick, you still had to come to work. Like it was, I don't care if you still have a cough or I don't care if wherever our workplaces are, I think we've all experienced this at some point where it's like, oh, I can still go in. I just have a cough and a bit of a sore throat. Or else you would hear people say, oh, I'm not going to go to work today. I'm going to take a mental health day. So that was always the day that you just felt off. You couldn't get out of bed. You didn't feel. Do you think that moving forward, that idea will change this, oh, I need a mental health day? Do you know what I mean? Like now that we're able to identify things better?
I think that we need to start teaching kids in elementary school the same way we talk about sexual health and sexuality. We need to start giving them a vocabulary in kindergarten about mental wellness. We have really an epidemic of mental illness amongst young people, teenagers, with anxiety absolutely through the roof. And I think they're struggling and their parents are struggling with what is real anxiety and what is normal. We've lost track of what is normal. And that's because I think we have social media and all the pressures around there. We also have a lot of pressure within our schools about what success looks like. And I think if we start to, teachers and students and parents start to have a vocabulary early on about well and what's not well, not just for physical, but also with mental health, that's the thing that's going to change the world. It's not going to happen overnight. And the other point to make is that if you have a mental illness, your physical health is imperiled. You have a higher risk of diabetes, heart disease, obesity, inflammatory illnesses. And the reverse is also true. If you have heart disease, obesity, diabetes, inflammatory illness, that increases your risk of mental illness. So mental health is health. If you don't take care of your mental health, you're imperiling your physical health. And the reverse is also true.
Wow. Okay, I want to talk about myths of depression in a second, but before we do that, TELUS has been looking for creative ways to give back during the pandemic, and one of the ways that we've been doing that is asking our guests um, for something unique in their community that they want to support, and how we can give back. You have chosen the BC Schizophrenia Society. We're going to be giving $500 to the BC Schizophrenia Society on your behalf. And I'm just curious, maybe you can tell us a little bit about that society and why you chose them.
Well, it's funny. I don't tend to work with individuals who have schizophrenia because they require a larger support system. But I think it's an area in mental illness and psychiatry where there are the greatest misunderstanding, and they face the greatest stigma. And the BC Schizophrenia Society does fundraising to help to support research and to really change the way people view mental illness. And most of the people that are on the board are deeply involved, have personal experience, loved ones, their children who have lived with schizophrenia, understand that this is a devastating illness. And I guess for me, I know whatever the mental illness is, the earlier that it is treated, the earlier we figure out something's going on, and the more fully we treat a mental illness, the best likelihood that we hold on to functioning, that the individual is able to live a full life. And so I've had really good experiences with the Schizophrenia Society, and I tend to feel that they're amongst our most vulnerable in that population of people living with mental illness. So anytime I can give them a leg up, I do. And thank you so much for that very generous donation.
Well, thank you. Thanks for telling us a little bit more about them. That's important. I Before we get into some myths about depression, can you just explain what is the difference between anxiety and depression?
Well, I think all of us have been anxious before, right? And we have, when you're anxious, you can have a feeling of dread or feel keyed up. It can be very physical experience, or it can be all emotional. You feel it in your head. But when I say to most adults, I feel anxious, most of them have some kind of understanding of what that means. But anxiety in a clinical, severe, the way someone would present to me with anxiety is horrible. It's an awful experience of oppressive worry, uh, distress, sometimes lots of physical symptoms. It could be headache, nausea, diarrhea, all kinds of physical shaking feelings along with those emotional feelings. And in fact, the people I most worry about in my practice around suicide are not depressed patients. They're patients who are depressed and have anxiety. Anxiety really makes people at greater risk because it's so awful. So, the difference between depression and anxiety, someone can just have anxiety and they can just have depression, but depression and anxiety, unfortunately, often come together. Anxiety itself is not associated with a depressed mood, so you don't feel sad or down, but it can certainly mess up your sleep. It can change your appetite. So there is a lot of overlap, but it you know what it means to be afraid of something. I see a dog on your wall, and I've had some mean dogs, and I'm a little scared of growling dogs sometimes. That physical experience and emotional experience you have when you're afraid of something, what happens when you're anxious is it's abnormal, excessive, unwanted fear. So that fear that is normal when something scary happens is happening all the time. Your brain is actually making it happen even though there's not any reason for you to feel anxious, like being a growling dog is not there. It's but you have those same physical and emotional experiences of fear.
I feel like I notice so many people saying, "Oh, I have anxiety. I have anxiety." And i- is it is self-diagnosing anxiety one thing compared to, like, if how do you know at what point with anxiety that you need to go see your GP or see somebody about it like, how do you know where it crosses the line?
And that's the point that we talked about earlier with depression. The same thing. Is it impacting your functioning? Is it stopping you from going to school, from going to work, from your relationships? Is it impairing your ability to parent effectively or to do the things that you want to do in life? So that's one. That's really the biggest piece. Is it functionally impairing you in a day-to-day basis? Is it impacting the quality of your life and your experience of joy, being able to do what you want to do? That's, I think, the most powerful reason that you should seek help, is it's getting in the way of your life. One of the things, though, is I often meet patients, they're in their 50s or 60s, they popped out of the womb anxious, and they think anxiety is who they are. And it's one of the most gratifying things to be able to treat when someone's had severe anxiety their whole life. And I'm able to say, you know what, I have ways that we can make this better to help you. And they just don't believe it. No, I'm always going to be anxious. This is just who I am. And being able to treat someone, help them to actually not be worried 24/7 is a beautiful thing. It's why I do what I do.
Mm, yeah. Okay. So some myths about depression. Um, Myth. Detoxifying treatments have antidepressant benefits. So if you detoxify yourself, if you cleanse, or is that what that means? To you can help your body like release all these
Yeah.
things?
First of all that's false. None of that
Okay.
works. We have natural detoxifiers. We have a liver. We have spleen. We can urinate and remove things in other ways. That's all how we get rid of toxins in our body. And in fact, some of those over the counter or through the internet detox treatments and all the things people tea detox or whatever, none of them have any evidence to support them. And in fact, some of them can be quite dangerous. It also suggests that, just by getting rid of some bad chi or something, you're going to overcome depression. Depression, anxiety, when they're severe, these are brain injuries that people are sustaining. They're neurochemical. There is a change in the way your brain is structured and the way your brain functions. Now we can fix that because, as I mentioned, you grow new brain cells. That's part of antidepressant treatment. You don't fix it by a detox treatment. Unfortunately, I wish there was an over-the-counter vitamin or supplement that can treat depression. There simply is not. But exercise can be a treatment for some people, especially if it's mild to moderate. Mindfulness, talk therapy, faith, all of these things can be help. They can be supportive. If you're in the more moderately severe range, medication, high quality talk therapy, that's where the evidence is. Detox does not work.
Okay, and I bring this up because, on social media, it's pretty easy to find all these different, well-meaning um, experts. You're a little suspicious about the well-meaning. And I have my own experience. As somebody who had cancer, I have my own experience with some homeopathy and some naturopathic stuff. And I have uh, very strong opinions about that and cancer treatment, and also, about mental health. So I want to clear it with you because I do, I want to know, like, is, homeopathy, is that something that works for a mental illness?
Okay, so you have strong opinions. I have strong opinions too. Homeopathy has no, no high quality research evidence, the kind that is required for medications, the kind that is even required for talk therapy, for instance. There is no research evidence to show us that homeopathy does anything. Now, that doesn't mean, because I think it's important to know, placebo is actually very powerful. And so I wrote about it in my book, and it was very challenging to explain that because I never want to dismiss someone's personal experience. We're all on our own journey. And so if you find something that you think is helpful, hey, you do you. I'm not discrediting you. Why, when you said well meaning, I kind of maybe gave you a little stink eye on that, is only because that there's a lot of money to be made in mental illness. It is unfortunately ubiquitous, far too common. Families are desperate. Their loved ones are struggling, And so someone says, I saw in the newspaper the other day, there was homeopathy for mental illness, for ADHD, I think it was. This is bunk. There's no reason. I read the research. You don't get anything out of me where I haven't seen the science underlying this. And when people don't understand or they're afraid of something, it leaves a little black hole there. They're not maybe trusting the medical world. They don't have all the information. And so that's where these conspiracy theories or these charlatans can kind of fill it in with really false information. And that makes me sad because it leads people to struggle for a much longer time than they might normally if they had access to evidence based care.
See, I don't even know how to say the word. That's how strongly I feel about it. Homeopathy or whatever. It's like, yeah. Okay, so cannabis is an effective treatment for depression.
You're pushing all my buttons here, sister.
Sorry, I'm asking because this is important stuff.
So, again, I will admit to very strong feelings on this. And when I'm talking about this, I'm talking about THC. So back in the day when my mom would have been smoking pot, it would have been a mixture of THC and CBD. Those are two cannabinoids, and they would be in a balanced mix. THC is what gives you the high, and it also is a pro-psychotic drug. It gives you the high, but it also can, in a vulnerable individual, provoke psychosis. But CBD is antipsychotic and actually has some anxiolytic properties or anti-anxiety properties. And back in the day, it was about 1% to 4% THC, and it was balanced with CBD. So people got a little high, but they also didn't get psychotic. What's available in the schoolyards here in British Columbia, for instance, would be in the 15, 20, up to about 80% or higher, depending on if you're using shatter, which is a super high potency THC, and all the CBD has been bred out, right? Because what you want is a super high without any of that sort of modifying or modulating of the CBD. This is really dangerous for a developing brain. It's not dangerous for everyone, but for some people who are vulnerable, it can actually provoke the onset of psychosis. There is no research evidence that I have seen, credible, high quality, randomized controlled trial research evidence showing us that THC, cannabis with THC, is a treatment for depression, for anxiety, for bipolar, for schizophrenia, but it certainly has shown us that it can make it worse. So I am not a fan of cannabis in young people. Once you're 25, your brain is fully formed. You're not mentally ill. Knock yourself out. Just don't drive because you're still dangerous when you drive and you're high. It's like drinking alcohol. But before that, it is a dangerous drug, unfortunately.
Okay, dietary supplements are all you need.
I wish that were true too. Now, I mentioned earlier the gut biome, the bacteria that live there, they are actually critical for mental health. And a lot of people don't realize that, but the Mediterranean diet, there are studies showing as an augmentation for depression treatment, just like exercise can be very valuable in supporting your mental health, maintaining your wellness as you've recovered from a depression. It's very interesting, some of the new research coming out about kids who have had a lot of ear infections, have had lots of antibiotics, that can kill off some of your good microbiome in your gut and may make you more vulnerable later in life to developing depression and anxiety. So that we all know that there's a connection between our gut and our brain because we've all been really anxious and felt nauseated and maybe had some diarrhea. That is actually your gut reacting to your brain's anxiety, right? This is just one example. There are many examples showing that what you eat does have an impact on your mental health. But do we have data around specific supplements? None. And there's been a lot of research in this area, but no data to show that a particular supplement is valuable in helping your gut biome and protecting you from depression.
If I am worried that I have depression or anxiety or something is just not sitting well, and after listening to this conversation, I feel like, oh, maybe there is something up with my mental health. Should I immediately try to find a psychiatrist? Should I go see a naturopath? Should I go see a homeopath? Or should I contact my GP? And if I don't have a GP, should I try telehealth or a walk-in clinic?
Yes, the last bit. So if you're worried about yourself, the best place to start, if you have a family doctor or a nurse practitioner, if you don't, we have virtual care, and through TELUS, we have access depending on the province you're in, to Babylon. We have Acura. So there's lots of opportunities to reach out to get virtual care, or with a walk-in clinic, as you said. That is the best place to start. Please, if you connect with someone and you don't feel like they understood or you don't feel validated, don't give up. There is always a path ahead. So if it's not a good experience, try the next person. There is always truly a path ahead.
I totally agree with you, Diane. And I know sometimes as women, we go in and we speak to healthcare professionals, and sometimes women aren't believed. That happens, and it happens a lot to people of color. It happens to, there's a great, people living in poverty don't have the same access to healthcare that many others do, but there is always a way to reach out. And if someone doesn't believe you and you know that there's something up, to just keep trying, right?
Absolutely, absolutely. And we have resources within TELUS through through Habitat, with access for paying psychotherapy. So there's a bucket of funds that everyone has access to. And I've had lovely feedback from some of our colleagues just saying what a difference it made to be able to have that fund there, to be able to get the right therapist for them. So we have EAP processes that you can go through. There's a lot available within the organization, but if you're not comfortable within the organization, your family doctor, going through virtual care, going to a walk-in clinic, there's many different ways to access treatment.
Awesome. Always wonderful speaking with you, Dr. McIntosh. I always learn so much. Your book, This is Depression, is everywhere that you buy your books, and you can find them online, the book online too. And you can find out more about Dr. McIntosh's work on her website, which is that's Dr. McIntosh. It's Dr. Diane McIntosh, and follow Diane on Twitter at Dr. Diane McIntosh. Thank you so much. I really appreciate it.
Thanks, Mary.
Thanks for listening to another episode of TELUS Talks with Tamara Taggart. Be sure to subscribe so you can join us every Tuesday for another conversation. You can also check out our website, telus.com/podcast, and subscribe to our YouTube channel at TELUS Talks.